Hello, welcome to Group 15 Strategy Presentation, Mayo Clinic Virtual Reality Med-Ed. Our virtual reality training system is for medical professionals. We will train medical professionals with real-life simulation and live disaster relief training, dangerous or otherwise logistically difficult situations, difficult surgeries, just to name a few. Our aim is to train and prepare medical professionals to be ready for any heart-pounding situation they may encounter. Our service industries include healthcare professionals, workforce development, electronic medical device manufacturing. The healthcare virtual reality market was a $384 million market in 2022 and is projected to grow to just over $1 billion by 2029. It is projected to have a compound annual growth rate of 16.6% from 2023 to 2029. Many factors will affect this rate, including COVID-19 and our current economic state. The global healthcare spending contributes about 10% of the global GDP and is continually rising in the recent years due to the increasing health needs of our aging population.
Our customer segment will encompass the niche market of healthcare professionals across several microsegments, including medical schools and universities, research institutions, medical professionals, major and minor teaching hospitals, and hospital healthcare systems. One area of particular interest is community hospitals in need of continuing education and training programs. As of 2022, there were 5,139 urban and rural community hospitals, and oftentimes these community hospitals have a limited budget for training programs and materials compared to major and minor teaching hospitals or healthcare systems. We believe we can meet this need with our Mayo Clinic VR Med-Ed service.
Given our customer segments, here is how the VR medical training platform addresses the specific needs and pain points of these customers. First of all, the platform provides an engaging and interactive environment that traditional methods may lack, thus enhancing the learning experience for medical professionals. In terms of flexibility and accessibility, remote and on-demand access to training ensures that hospitals and healthcare systems can fit training into learners' schedules without disrupting their work. Next, the VR medical training platform reduces the reliance on physical training resources and facilities, which lowers costs for institutions and individuals alike. In regards to standardization and quality, offering a consistent training experience that meets high standards ensures regulatory compliance and improves overall healthcare quality. And lastly, providing realistic and repeatable simulations supports institutions interested in conducting high-quality experimental studies with the ultimate goal of improving patient care broadly.
The ability to add realistic training for new learners and retraining for seasoned healthcare professionals is important for muscle memory in reality. This can be used in recertification, new education such as guideline changes or new equipment purchases by the customer. The environment can be generic from the company or tailored to the customer using their real environment for hospital rooms, ambulances, crash carts, and other items using technology by the company recreated for the customer to increase realism in training. The team dynamics will also be adjustable to the customer. Examples including operating rooms, emergency rooms, ambulances, and clinic teams. Debriefing is where a majority of the learning occurs so that the learner can see their strengths and weaknesses in real time with recording ability. This will allow for objective feedback on performances. The conversations about how the scenario went with the ability to play back is important to educate in high-stress, low-frequency patient encounters, such as cardiac arrest, airway maneuvers, trauma, and other scenarios.
At Mayo Clinic VR Med-Ed program allows physicians to perform practice surgeries based on their patient's ultrasound or MRI scan. A good bedside manner can be tricky skill to convey in the lecture hall, lab, or crowded hospital. But our VR technology provides a new setting for teaching interns about patients' experience. In addition, having access to VR training can complement live practice and allow staff more locational flexibility. Furthermore, VR will make medical education more affordable by lowering costs at training facilities and staff. Completing training more quickly saves staff members valuable time, which can then be spent on the floor. At Mayo Clinic VR MedEd, we're committed to creating a better way healthcare professionals are trained. Our VR technology provides immersive, realistic, and interactive training simulations, allowing medical professionals to practice complex medical procedures without risk to patients. In addition, specialists can train to work with patients, communicate with them, understand how to make a correct diagnosis starting from the first contact. The use of Mayo Clinic VR in medical education has been the subject of numerous research studies, highlighting its efficiency in improving clinical outcomes and enhancing medical education. Mayo Clinic VR MedEd offers residents and other learners an immersive and enjoyable experience and complements more typical teaching methods. Learners can make mistakes without consequences in a VR training environment, supporting improved performances. VR is also less expensive than other forms of simulation learning. The applications of Mayo Clinic VR in medical education and training ranges from improving interview and counseling skills to teaching surgery and other procedures.